So good afternoon. Thank you so much for joining us in today's joint briefing between UNC Health and Duke Health on the J&J vaccine pause. I'm Phil Bridges with UNC Health. And if you haven't already and you need to record locally on your computer, just ask for permission in chat and I will get there to you and give you that ability. So we'll have some opening remarks from our two experts from Duke and UNC, followed by your questions. And I'll begin the introductions, followed by Sarah Avery with Duke Health. So our first expert today is UNC Health's Dr. David Wohl, and he is professor of medicine in UNC's Division of Infectious Diseases. He's site leader for the HIV Prevention and Treatment Clinical Trials Unit at Chapel Hill and co-lead of the UNC Viral Hemorrhagic Fever Research Working Group. And during the pandemic, Dr. Wohl has been very intimately involved in all aspects of treating and researching COVID-19 and overseeing the vaccine clinic at UNC's Friday Center. So now I'll turn it over to my colleague, Sarah. And Sarah, would you like to introduce yourself and Dr. Wolfe?
You're on mute, Sarah.
Sarah, you're on mute. You're still on mute. There you go.
Sorry, I hit the click, but moved away too quickly. Thank you, Phil, and everybody probably knows Dr. Wolfe. He is associate professor of medicine at Duke University School of Medicine and is an infectious disease specialist and has been leading our pandemic response. He's also sitting on several committees guiding athletic participation, including for the ACC, and correct me if I'm wrong, Dr. Wolfe, the NCAA, is that right?
Yeah.
And again, has been our leader on the pandemic effort. And there's Dr. Wolfe.
Great. So what we'd like to do is get some, before we start taking questions, just have each of our speakers just share some thoughts on the pause and how we got to where we are today. So if we could start with you, Dr. Wohl, some comments.
Yeah, thank you everyone for being on this call, and hopefully we can transmit, I think, clear messaging to people out there in North Carolina, because there's been certainly a lot of interest, a lot of confusion about vaccines from the onset. So I think this is a really good opportunity for us to be crystal clear. I won't say much because I do want to hear from Dr. Wolfe. I think both of us recognize that the events of the last day really reflect the vigilance that we have in our systems, right? So we have a safety net for reasons. There's scrutiny and monitoring for adverse events, and the system is working for us. 6 events were detected. They're concerning out of almost 7 million doses of the Johnson & Johnson vaccine, and that we were able to see our federal colleagues recognize this, respond really quickly, and make a call to action, I think does provide reassurance to those who think that the system may not be as rigorous as it should be. I think this is evidence that it is. So we'll get into some of the details, but I'll turn it over to Dr. Wolfe to add his comments.
Hey, thanks, Dr. Wohl. I appreciate the chance to speak, and Dr. Wohl and Wolfe, if we can get through our tongue twisters, we'll be doing well. Yeah, I completely agree. That was almost the first thing that came up on some discussions with colleagues of mine this morning as well, which was to say, it's actually reassuring that such a rare signal can filter through the noise of vaccinating so many people and be detected. You know, one of the things that I think it's worth us remembering up front is that all of our vaccines here for COVID, because of the nature of the pandemic, and are all under emergency use authorization. And yet true for each medication or vaccine that we ultimately approve, there's always going to be the chance for rare numbers of side effects to appear outside of clinical trials, and we need robust systems in place to be able to find those. And here you've in fact got a signal which we need to know more about, frankly, and probably will in the next couple of days, about a rare incidence of a clotting problem that we'll talk about. And so I think the pause actually is very, very reasonable. Now, is it going to take some sort of pivoting on behalf of anyone running vaccine clinics in both of our institutions? It will. And I think, will it require a careful examination of the data, not just from us, but from patients and advocate groups? Absolutely, that's appropriate. But I do want to sort of start by that reiteration of, hey, this is the safety and the signal working appropriately, and let's find out more.
Great, thank you so much. So now, I mean, we really don't have a huge agenda. We wanted to make these experts available for your questions and put everybody sort of in the same room at one time. So if you've got questions for Dr. Wolfe and Dr. Wohl, please just jump right in and ask away. Just go ahead.
This is Amanda Lamb at WRAL, and for either of you two doctors, do you think that this is going to make people afraid in general of the vaccines, and how do we continue to reassure people that the vaccines are safe?
Dan, do you want to take that first?
Yeah, sure. We can take.
Yeah.
Look, I think it's important for people to have a chance to sit back, clinicians as well, and look at the data and see where it leads us. I would say for patients' reassurance up front, this is one of 3 vaccines. There has been no safety signal despite tens of millions of doses of both Moderna and Pfizer. And our message, and my message to any patient I see, is that we should continue to use those liberally while evaluating what's going on here. Look, at the end of the day, patients also need to make their own decisions. And what I want to be able to put in front of patients is my clearest interpretation of what that data shows. And in a pace where they feel like they're getting as much information as I know, and when there's sections of data that I don't yet know, that we're clear on that too. And so I think that's really what the CDC and the FDA are trying to do here, is to say, look, let's pause, let's gather our data up, and let's have a look at it. And therefore come back to people with good confidence that we've fully understood what this risk is. It's also probably important to put that risk in the context of where we are in a pandemic, and balance that risk against ongoing recognition that we still have lots of people, in fact, an uptick in many parts of the country of patients coming down with COVID, and in some instances being hospitalized. And so I think appreciating that risk a little more will in fact, hopefully allay any hesitancy. And hopefully we can present that in clear data today to help start guiding people. David, I don't know if you want to answer that.
Yeah, no, just real quick. I mean, I think this is a really important question. I think maybe the greatest side effect of what we'll see from this is maybe more hesitancy or more skepticism. And I do think we have to try to control that. There very well may be people who say, see, I told you so, there's problems, but really put this in context, as Dr. Wolfe mentioned, these are very, very few cases. So apparently there's not others that are being investigated. These are the cases we know about. Out of 7 million doses, so it's pretty unusual. Look, what do we know? We do know that these vaccines, all 3 of them, work, that they prevent people from dying and getting hospitalized. We know that. We may know that there may be a very, very rare side effect associated with this one particular vaccine, which has other properties that we like, including being easy to administer and given 1 dose. We don't know that for sure, but we're investigating it. We have people who react seriously to penicillin. We don't throw away penicillin. Penicillin is very, very useful as an antibiotic. It saves lives, even though some people can get a reaction to penicillin. So we have tools. We have to understand how to use them. Sometimes they're a little double-edged, but the vast benefits of these vaccines so far look really, really to outweigh any risks that are. So I just think, again, messaging that reactions are not unexpected. We sometimes just have to figure out what they are, but there are reactions to most biologics that we use. We just have to put it into the context Dr. Wolfe talked about the risk and the tremendous benefits.
Hi, this is Jason DeBruin, North Carolina Public Radio. Just sort of following on what you just said, is there any concern that we're actually being too cautious here? I mean, COVID-19, at least statistically speaking, is far more dangerous than these 6 out of 7 million doses, right?
Yeah, Jason, I think that's a really healthy debate as well, which is to say, what is the appropriate way to respond to a signal? You'll find some commentary who'll say, we should have continued to look for data and continue to roll out vaccine. And you'll find other people who'll say, look, it's appropriate to take a pause, to reassess, and then to kickstart again. I think the right answer could be either of those, provided people understand that this is an appropriate way to look for safety and to move forward. You might, what I hope is not the ultimate outcome here is that people lose faith in the overall process. I think David started this out really well by saying this is an appropriate vision of a system that works when you can see early signals and you can investigate them more thoroughly. But if that gets misinterpreted as in any way a loss of faith in vaccination in general, then we will have worse outcomes because people won't get vaccinated. And that I think is our clear message here, is that this is not a call not to vaccinate at all. In fact, quite the opposite. That call still needs to be made. How you officially respond to a signal like this is certainly up for interpretation, but I think it needs to be put in the context of continuing to vaccinate, particularly for the time being, using our other 2 mRNA vaccines, and we have plenty of those here, that if you're booked in to currently get a J&J vaccine, please come forward and we'll adjust and we'll give you the next one, Moderna or Pfizer. They are safe.
I had a question for David Brian Anderson with the AP. Just candidly, you're a candid guy. Do you believe this is overblown right now? We're talking 6 people out of 7 million. I'm sure off of this news, there are going to be more than 6 people across the country who do not take this vaccine as a result of that. Is it overblown in your mind?
Yeah, I certainly wouldn't have wanted to be on the conference calls that were occurring overnight. And I'm sure there was heated debate about the balance of underreacting versus overreacting. I do worry about the overreaction to these 6 cases. Now, we should be clear, one of these women has died and another is apparently critically ill. And I think the severity of those events may have tipped the balance pretty significantly. So it is, I don't know. I actually don't know what I would have done in the same shoes. And I think that this was a very tough decision. But I agree with you. You can't put the toothpaste back into the tube. And I do worry a little bit that the faith that's lost. But remember, this does come on the heels of the AstraZeneca experience. And the AstraZeneca vaccine and the J&J vaccine both share adenovirus as a mechanism of delivery of the genetic information. And so there may be some shared property. So maybe the combination of the AZ experience in Europe and this as being maybe the straw that broke a camel's back for the committee. So we'll hear more about this, and it may be that we do see J&J used, but perhaps in a more restricted population, but we'll see.
David, I think
Vanessa Ruffles Vanessa Ruffles has been waiting patiently. Vanessa, you want to jump in with your question?
Sorry, I didn't want to cause mass chaos. But yes,
That's
thank you
right.
for the opportunity. This is Vanessa with WCNC Charlotte. Really what Dr. Wohl just said kind of leads really well into what my question was. Is there any indication that there is something different about J&J, either chemically or biologically? Because obviously this seems to be more associated with J&J, that you could signal for us or just explain.
Cam, do you want to explain like the commonality?
Yeah, I mean, the commonality here is both that they use an adenoviral vector or a sort of means of getting the vaccine to work, but they are different adenoviruses. So whilst it's theoretically possible that they may share side effects, we don't know that for certain yet. The commonality in the clinical cases that have been noted is that these are a really rare condition called central venous sinus thrombosis, and it's associated actually with a loss of platelets, which typically, interestingly, leads to people bleeding more, but in this instance, it leads to a clotting situation, which is pretty uncommon. And I think, so that's the similarity, is that they both seem to be stimulating, as much as we know from these cases so far, the same sort of side effect. Now, what I think I was going to add actually to David, to your previous comment, is the one other factor that may tip people into wanting to talk more openly about this is that from a clinician standpoint, diagnosing a central venous thrombosis is actually quite difficult. This is a rare condition that many of us will probably never see in our lives clinically, unless you're a sort of a specialized neurologist or hematologist or emergency physician. And I think there's a benefit in putting a rare side effect like this out into public discourse. In fact, the AstraZeneca experience is on the front page of the New England Journal today, to help clinicians make sure that we don't miss any signals like this that may occur. So in answer to your question, I think there is preliminary information to suggest that they look very similar. And that'll probably for sure be one of the things that the CDC and FDA regulators are looking at, to say, can we learn from the AstraZeneca experience here? And can we learn, frankly, from our colleagues in other countries who've already had to face what they would do with their AstraZeneca vaccine. For example, Canada, some European countries, Australia have done what David suggested, which is to tier it to older adults who seem to be less at risk of getting this side effect in the first place, where it still has a huge benefit in terms of its safety and efficacy to stop COVID. That's what we need to learn from this data.
I see we have a question from Patrick Thomas. Patrick, I think you've been waiting patiently, so jump right in.
Hey, thank you, Phil. Good afternoon, Dr. Wohl and Dr. Wolfe. I had a quick question, and I was wondering about your thoughts on this today, how this will impact at least sort of immediate efforts to vaccinate a couple of different vulnerable populations. One, homeless populations, and I think some jail populations as well. They'd like to get the one shot because of convenience, especially the homeless. So how will something like this sort of impact those efforts for the time being?
Yes, certainly. You're right, Patrick. There will be some stretching of the system. Look, for a long time, we didn't have the Johnson & Johnson vaccine available, and we were working with all sorts of populations with the Pfizer, Moderna vaccine options. It will just continue to do so. It means we work harder. We do what we need to do. It doesn't mean we pull back. I think Cam and I both are working on projects where we're trying to make sure more outreach is done, providing vaccination to those who don't have ready access to it. I had planned on using J&J, and now we're going to switch to using Moderna or Pfizer. But our plans are going to go full steam ahead.
Hi, this is Sonia Warich with the Triangle Business Journal. I wanted to find out how many doses have already been administered by each health system, and how many doses do you have on hand, and what's the plan for those?
David, I'll go. We've given it just under 12,000 doses so far. I don't have on my fingertips exactly how many we have at hand, but what we do with those is that we'll continue to keep them here and await analysis of the data from the CDC and FDA before moving forward with them. But out of those, we've given 12,000 so far, roughly.
Yeah, it's a really great question, Sarah. So we've given almost exact same, 11,400 about, and of those, and I think if you read the FDA statement, the concern is for folks who've gotten vaccinated within the last 2 to 3 weeks. And so we have about 5,500 folks who fit into that category. They were vaccinated within the last 3 weeks, last 21 days. So that's the group we're paying more attention to, those who received the vaccine, the J&J vaccine, more remotely. Less concern, of course, for them. We do have some on hand, but not that much, fortunately, and had very few people scheduled today, tomorrow, and for the rest of the few days in the future. So it really hasn't impacted our operations very much at all.
And that part's been the same for us too. We've been able to pivot back to Moderna without delaying anyone today.
A question from Rose Hobana in chat. Rose writes, I've got a question too, following on Jason's questions. Given the mixed messaging that's plagued the past year, does this move risk confirming concerns and fears of folks who don't believe in vaccinations? I think you've addressed that a little bit, but if you have any other thoughts on that.
David, do you want to?
Yeah, Rose, I do think that this is a real concern. And I think that's why Cam and I are really, I think, passionate about messaging completely that the benefits of these vaccines really do clearly outweigh risks. We knew there would be risks. You can't get away scot-free. And so now we're finding out with millions and millions, over 125 million people administered a COVID-19 vaccine in the United States. We're going to find the very, very rare adverse event. That may be what we're seeing right now. We don't know that. More investigation has to be done. We don't know about underlying conditions. We don't know about other medications. So I think we can't jump to conclusions just yet. But even if these 6 cases or additional cases emerge of this particular clotting problem, in the context of the benefits of the vaccine, we really do have to keep messaging that it's important for people to get vaccinated. On the same page where you have reports of the Johnson & Johnson vaccine leading to perhaps 6 of these clotting issues, there's all sorts of stories about how we have to get more people vaccinated and the efforts to do so. And I think that's appropriate.
you talk
Amanda Lamb again. I'm sorry. I didn't mean to talk over you. Just a real quick follow-up to that. You were talking about pivoting to other vaccines. So are all the health systems doing the appropriate thing by taking the pause right now? Because it's a recommendation, not a mandate from the federal government, but they're pretty much following what the FDA is doing and saying, hey, we've got enough of these other vaccines. We're just going to go ahead and move forward, keep it rolling, but just with a different source. Is that the appropriate course of action?
I mean, I think it is at the time being, and that's actually the state recommendation too. They're not enforced recommendations, but I think any system under the guidance of the CDC and FDA to say the same thing would do exactly that. So I'm not aware of anyone who's not doing that, put it that way.
Jamise Price, you've been waiting patiently. Jamise has a question for you.
Right. Okay. So Friday, the CDC came out to say that the J&J vaccine was safe, and now 3 days later, we're getting recommendation to put a pause on this vaccine. That's pretty confusing to the general public. One saying the vaccine is safe, and now the CDC is out.
I can't hear the question. I'm sorry, Jamise.
Okay, yeah, I thought maybe it was just me. Jamise, if you want to put your question in chat, we're having a hard time hearing you. We'll come back to you if you want to just type that out. But yeah, no, we couldn't hear you. So we'll keep going. We'll move along. Let's see. Let's see. Call on someone who hasn't spoken yet. So Marco, you've got a question there. Want to go ahead and ask that?
Thanks, Phil. Yeah, Marco Quiroz Gutierrez from Fortune Magazine. So basically my question is going along with something that was said previously. So if, healthcare providers aren't following the recommendation for some reason, what are the liabilities for these providers that they could be exposed to?
Yeah, Marco, I think you probably don't have great experts on the line right now to answer that question. I'm not sure, but I think, as Cameron said, I don't think that there's really going to be folks who have that option. And I think this is the federal authorities have pulled federally administered J&J vaccine and have recommended states follow suit, and our state has recommended the same. So I'm not sure that that's going to be an option for people. And I don't know about folks who don't listen to that for some reason or another and what happens to them, the consequences.
And we'll move on to Helen Chickering. Helen's with Blue Ridge Public Radio. Helen, would you like to ask your question?
Sorry. Yes.
Oh, there you go.
Sorry. Yeah, my question is, what do we know so far about the vaccine recipients who developed clots with the J&J vaccine? They seem to be women, their age range, and then comparing that to AstraZeneca, and help us understand as investigators try to unpack this and figure out what's going on. What will they be looking for? What sorts of, kind of take us behind the scenes if you can. Thank you.
Yeah, I mean, it's a really good question. So what we know so far is that of the 6 individuals here, they were 6 women. They were women who developed their symptomatic illness fairly early, as David mentioned earlier, after their vaccine course. None were so early as to be the first sort of, I think the earliest was at day 6. And so what's important to clarify for people in the community is that, some people will get side effects the day 1 or day 2 after a vaccine. This is not what we're looking at here at all. In fact, they are very separate. Whereas the 6 women involved between day 6 and 13 had side effects that developed at that stage. Central venous thrombosis is a difficult thing to find and can present in a number of different ways, ranging from headache to confusion. So I wouldn't say that we have clarity yet from regulators as to how those 6 individual cases played out. But one of the things I think that'll be really important for us is to compare how these cases worked in relation to what we know from the AstraZeneca. So in that situation, they were thrombocytopenic, meaning their platelet count had fallen. It did appear to be a fall related to the development of a quite a unique antibody called an anti-PF4 antibody, which is known about to cause drops in platelet counts that can be significant. And that's important because I do think it then ultimately plays into how we as clinicians would treat someone who presented with this kind of condition. They can be quite different than the standard ways to treat regular blood clots. So that data needs to come to light, needs to be fully understood from each of these 6 people. And I think the pause will give us a chance to do that. And it'll also give us a chance to make sure we've had a really good look to see if there was anyone else going through that. So the take home is generally young women, although the AstraZeneca involves some men as well, and not occurring immediately after vaccination, but within typically the first 2. I think one case in Europe stretched it to about day 21 or day 22, but usually the first couple of weeks.
Taylor Heeden out of Johnston County. Taylor's got a question. You wanted to jump in and ask that?
Yes, this is Taylor Heeden from the Johnstonian News. So in our community here, vaccination rates have already been below both the state and national average level. A lot of people here are already hesitant to receive a vaccine, and we're worried that here this news might actually push more people away from the idea of being vaccinated. So my question to both of you doctors is, what would you say to the people in these communities who now are afraid of vaccines because of this development with the Johnson & Johnson vaccine?
Yeah, I think it's a really good point, Taylor, and it builds on what we've been saying. So on the other hand, we have given many more people the Moderna and Pfizer vaccines. So really, this is, I think Johnson & Johnson represents something like 5% of the vaccination that has occurred in the United States. That means 95% of the vaccines that have already been administered have been Moderna and Pfizer, yet there's been no signal for adverse events of anything like this. And again, look at the sensitivity we're looking at with 6 people, very concerning for a very smaller number of people who are receiving the J&J vaccine. So if anything, I think this should provide some reassurance about the Moderna and Pfizer vaccines vis-a-vis what we've seen with J&J and the scrutiny that it's been really put through. So for me, I feel like more and more, as so many more people have gotten the other 2 vaccines and we're not seeing a problem, it should be very reassuring for the folks in Johnston County that getting a Moderna or Pfizer vaccine really is supported by the data that looks more safer than anything else that we can really compare it to, and we know about its effectiveness.
I'd add to that, Taylor, and say that we now also have data that actually shows the effectiveness in reducing, in real patients, hospitalizations, deaths, and transmissions. We have great data from a large cohort in Israel where they've been vaccinating using the Pfizer vaccine liberally. We have really good data from healthcare providers here in the United States showing this reduces hospitalization and death. And like David said, we have a wealth of safety data now from those other 2 mRNA vaccines. So, I would point people in that direction to say we have averted tens of thousands of deaths statistically already because of what we've done. And whilst this is important, this should not be a pause on those other ones, quite the opposite.
And Taylor, one thing to really recognize, especially in Johnston County, right? So we know that there were periods of time where Johnston Memorial was full to the brim with people sick with COVID. People were transferred to Duke and UNC regularly on ventilators to our ICUs from Johnston Memorial and from other hospitals. So we know that COVID-19 can make people sick, but the side effects from COVID-19, which include clotting, we saw many people get COVID-19 and get sick. Many more than 6 people got clots due to COVID-19. So on the balance of things, it's probably more, it's prudent to get vaccinated against COVID-19 if you want to avoid a clot than to not get vaccinated. So just again, context is everything. And we can talk about the outliers, but the vast majority of people who get these vaccines have no problem with them at all and are now protected from getting infected and getting sick and infecting others.
We had 1 to 2 out of 100 patients in the hospital develop a clot either in the hospital or when they went home. And let's compare that against the 1 in a million cases here. Now, different levels of seriousness, but to put it in context, that the prevention of that is also going to play.
Let's move on to Cole with WUNC. Cole, go ahead and ask your question.
Hey there, thanks for taking my question. One of the biggest concerns that I have is that people who were maybe on the border about whether they were going to get a vaccine or not, they finally get signed up by a relative or a family member who's really pushing them to get this Johnson & Johnson, and it's easy because it's just one shot. You know, sure, you can try to reschedule them, but how are providers working to make that a reality rather than just a possibility?
I mean, we've changed anyone who's got a current scheduled appointment to modify the vaccine that they get, and we'll automate their second reappointment to be set in stone too, given that all the mRNA vaccines are twice. But your point's well taken. We would never want this to become a signal that people shouldn't turn up to their presented and scheduled appointments. We have vaccine that we can give to people as alternatives, and we can absolutely work through the scheduling of the second one. We know a lot more now about the timing, flexibility with the second dose. We can make that happen, and the supplies look good that there's no reason why the second dose can't be given too. So, you know, is it a bit of extra logistic work for patients and clinics? Yes. Is it any different than what we're doing? As David said before J&J was released, it's not. So we can make that happen.
Yeah, absolutely. For UNC Health, if you have a J&J appointment, come anyhow, and we will give you either a Moderna or Pfizer vaccine. We don't want you to delay. People who are walking in today, we're explaining things to them. We're offering them a Pfizer or Moderna vaccine, whichever we have on hand. It's gone really smoothly. So we don't want people to delay if they still want to get a vaccine.
Brian Anderson with Associated Press. Brian, you said you had another question.
Yeah, thanks for that, Phil. I had one for each of you, just quick for David. I know following up on our conversation last week about fainting, you had said that it might be attributable to the population and the demographics itself. Is there any update on that front? And for Cameron, my question is just really to the medical side of today's developments. Given that there's a higher risk of becoming infected in the first place, if you get a J&J vaccine, I know the hospitalizations and deaths are sort of similar enough across all three, but given that the increased risk of fainting and these reports of blood clots, what medical benefit, if any, does a J&J vaccine have that others don't, other than the fact that it's just a single shot? In other words, just is there any reason someone should choose to get a J&J vaccine instead of the other two?
Do you want to go with yours first, David?
Yeah, as long as you could still remember the second. So, yeah, Brian, this is a really good point. I'll tell you, since our conversation, I've become increasingly convinced that the J&J vaccine does not lead to syncope, does not lead to fainting, that it really is the population more and more. Again, I can't say 100%, but to a large extent. Since the time that we spoke, we've instituted a procedure where we screen people who have a history of fainting with blood draw or injection, regardless of which vaccine they're coming to get. And we have them go to a special area. We recline them. It's quiet. It's almost like a first-class lounge. They're vaccinated in the chair and then observed in the chair. And we have had hardly any further fainting events at all. The only fainting events we've had is when people weren't exactly straight with us when we screened them and ended up in the usual route and then feeling lightheaded with either vaccine out on the regular floor. So that tells you something right then and there. So I think it is a lot of anxiety, which I understand, and is understandable, but I don't think the fainting issue is really due to any ingredients, particularly in one vaccine versus another. Over.
And I'm glad you say that, David, because that is also our experience as well. You know, Brian, you make a really good question about like why would I recommend a J&J to anyone? I think the thing, it may be harder to say that on an individual level, which is why I'm happy to recommend that we pivot to a Moderna or a Pfizer to someone today and don't have any concern about that. I think what we don't know that's important to remember here is for none of these vaccines do we have great data yet on durability. We don't know how long they last. And there is some theoretical literature out there that suggests that perhaps the adenovector might in fact last to a slightly more protracted sort of length of immunity. There are also logistic advantages in its production and its storage and its administration, obviously being just once a day. So I think nationally there are really important reasons why it's a valuable part of our arsenal. We don't have the data on durability yet. That's still pending. And so at the moment, I have no fear about moving someone away from a J&J and moving to a Moderna or Pfizer. I think as we get further data on how long they last, we can be a little bit more selective as to perhaps who gets which one.
The other thing I'll add to that, and I think that's exactly right, is so there's this public health perspective, which is the more vaccines we have out there, the more people get vaccinated. And there is a benefit of one and done, because for the Moderna and Pfizer vaccines, of course, it takes 2 visits to be fully vaccinated. So if we really want to get as many people fully vaccinated, the J&J was really important. So it's disappointing. And I'm certainly not happy that we don't have that tool that we were really starting to ramp up. And on top of the manufacturing issue at the Baltimore plant. So that really does hurt us. The other thing is that J&J has the best data in people on protection from variants, from those that were identified first in South Africa and those that have been identified in Brazil. So while we're getting some more data from the other vaccines, we have really good practical data from people who were exposed to those variants and had the J&J vaccine, and it's very, very reassuring. So I liked that about J&J, and those variants are circulating, including here in North Carolina. So this is a disappointment, no doubt about it, but we need to make it up with Moderna and Pfizer and go full speed ahead.
Michael Perchik with ABC 11, you had a question. You want to jump in and ask yours?
Yes, good afternoon, guys. I certainly appreciate you chatting with us today. The NCDHHS says that less than a third of North Carolinians are even partially vaccinated at this point. Yesterday, we had heard from providers across the state that they were having trouble filling appointments. Twofold, what is the danger of us not reaching a level of herd immunity or the slowdown continuing? And what impact do you think the J&J pause is going to have on our vaccination rates here statewide?
I mean, I'll tackle the first part of that. I think that answer will come to light when we see what data comes in the next couple of days. I think if that data is similar to what we currently know, and that in fact we are allowed to start reusing this in a way that makes sense, then I think that, you know, we'll have minimized any problems in terms of overall vaccine uptake. It'll also be dependent on how we as a group here craft this message. That I think is very important. It needs to be an honest and open message, and we're trying to. I think, you know, that's why David and I were very happy to put this together. In answer to the first part of your question, which is, you know, we sit at less than a third. What does that mean? That weighs heavily on my mind. I'll be totally honest. You know, when we think about modeling and projections of what COVID can still do. And when I look to European colleagues who are going through resurgent episodes, and I look to Michigan, who's going through resurgent sort of hospitalization closures and pauses, that gives me great pause if we don't do a better job at this. So you know, that is front and center on my concern. Like we talk about a 70 to 80% approximate herd immunity. Like we're a long way from that. And I think our community needs to be able to look at this data and look at each other in the eyes and really and ask, is that where we want to be? Because I don't want to be sitting here in 12 months at a position where we still face hospital closures, we still face more admissions and deaths than we need to, when we have a tool in our arsenal that can stop that.
Yeah, let me just add real quick, Michael. I think that's exactly right. And we cannot take our eyes off the prize. There are going to be setbacks, there are going to be speed bumps, and this is one of those. But we have 2 really great vaccines that are still out there. We need to get more people immunized. And just really interpret that 34% of North Carolinians being vaccinated, you know, in full light. We don't need to vaccinate every single person from the 6-day-old to the 96-year-old. We need to get people who can really get sick vaccinated, and that will make a tremendous difference. So we shouldn't really be looking at the entire population of North Carolina. I think we should also be looking at the population of adults, let's say 16 and older, or 18 and older, because you know, when you really look at who's sick from COVID-19, who ends up hospitalized, who ends up on a ventilator, who ends up dying, it's older people. And while younger kids can get infected, they don't usually get sick. And while they can infect us, that's not a big deal if those of us who are older are vaccinated. So I think we're doing better than we think, and we're closer to this than we ever were before. So we have to just keep pushing. And if enough adults get vaccinated, you're going to see a tremendous decrease, further decrease in death, ICU admissions, and hospitalizations.
Patrick, sorry, thank you guys. Patrick Thomas had a follow-up. Patrick, you want to jump in there? Sorry, I caught you off guard.
Yes, I do. But before I did, I know Jamise was trying to ask a question, and maybe someone can answer what she just put in the chat, because I find it interesting as well. She said, I don't know if she's having audio issues, but I'm just gonna read this for her. How do you expect people to trust science? Hey, can you hear?
No.
Okay, that's not me. Anyway, I'll just ask, how do you expect people to trust science when in the last 3 days there's been a medical side effect to the J&J vaccine? Friday, the CDC came out saying it's safe. 3 days later, let's pause the shot. It feels like a contradiction. So I was kind of wondering what you guys have to think about that.
I think that's a really good question, and I think it's something we're going to have to grapple with. But I would pause to make sure people are conscious that these are very different examinations of safety there. One is an examination of syncopal episodes that, as David said, we've all examined our data, as the CDC and FDA have, and found it not to be a problem. I think this is a different situation because we now have a collation of different data, which may not have been to light last week, where in fact we're looking at a very different event. And I would go back to what we both said at the very start, is this is in fact the recognition that we are picking up safety signals and we're looking at them. Does the optics of that happening within the space of a week make it challenging? Yeah, and that's why we want to make sure that messaging is as accurate as you can. David, I don't know if you have comments on that. I mean, front and center of my mind for sure.
I think it's really hard, and I think none of us can really say with certainty or confidence, how much of a side effect we're willing to tolerate for a really good vaccine. J&J may end up being a safe vaccine, except that there is some number of people, some very slight fraction, who can have a serious side effect. So if it's a 1 in a million, Jamise, is that acceptable for a vaccine that saves X number of lives, keeps people out of the hospital? These are tough decisions. I don't have the answer to that. Medical ethicists have to weigh in on this as well. But it could be J&J is a safe vaccine, but in our culture, in our society or our state, we may decide that 1 in a million people getting a serious, very serious life-threatening event is not worth it. I don't know where we draw the line, and I think the CDC is going to convene a panel of experts tomorrow to help draw that line, given the data that's out there. The other thing, of course, is you don't want there to be 12 and then 18 and then 36 and then 156 cases. You want to look at this sooner rather than later and not wait. So maybe this is a very early look to prevent there being more happening later on that we regret. So vaccines have ever been put through the scrutiny that these vaccines are being put through right now. And I think that's really clear. And again, as we keep talking about, this is a strength in our system. And maybe if there's an overreaction, there could be detrimental effects as well. But I think the CDC and the FDA are erring on the side of overreacting versus underreacting, probably because of the confidence they have in the Moderna and Pfizer vaccine, to be honest with you. So I agree with you. It does sound like a contradiction, but when you look at it a little bit more carefully, I think that what they're really trying to do is just find out, like, where's the right balance between how much risk we're willing to accept. And let's do the investigations we have to do to see if there is an association.
Now, can I ask my question now? Because it's a direct follow-up.
Sure, yes. And then we'll have
so
to
I was
finish
just going
up.
to say, to what you just said, Dr. Wohl, it seems incredibly important to have a lot of grace with patients who are coming in and getting the vaccine, but they are really hesitant. Why is it so important to be patient, maybe now more than ever, when you're having these discussions with people and trying to tell them it's okay for you to get this vaccination?
I like the way you said it. And I think from the beginning, and Cam can share his experience, I have tried to really understand people who are reluctant to get the vaccine. And we know that there's different reasons people have decided to hold off on getting vaccinated. The one thing we really got to do, though, is make sure that any decision is made with facts and not fear and not magical or mythical thinking. So when people have the right information, the accurate information, they make a decision, I respect that. I do think that people who think that that this was done shoddily or that the research is faked, the research is solid, and I think it's been done well. And as we're seeing, continues to be done to identify problems. I think when people think that this is some form of control, that's a conversation we can have. But learn the facts, understand it, and I respect your decision either way. But my advice to you is based upon what we know. And there's unknowns. There will always be unknowns, and we can share that with you. But the knowns right now might tip you one way versus the other. But yes, you're exactly right. No one should be forced to get vaccinated. Everyone should make a decision that's right for them and their families, but base it upon what we know and what the facts are.
I think that's right. And I think that's also sort of plays into a recognition that everyone has their own place where they come from when it comes to a decision like this. I've had many conversations with colleagues who had anxieties about pregnancy, anxieties about breastfeeding, anxiety about what this meant for their kids, concern about the speed of development, concern about long histories in the country of divisions across ethnic and racial lines. I mean, it's come from many different directions. And yet, I would say exactly as David said, when presented as all I can do as a clinician with the data as accurate as I know it, actually the vast majority of those people come around and go, that's what I needed to hear, is that I need to hear what the actual data said to allay the fears that I have. I think probably our biggest challenge is actually to get that data in front of patients in a way that they can interpret it in a space otherwise dominated by lots of media din and easy, quick messages that don't go into the subtleties of many of the things that we've talked about today. The actual number of people, there's been some studies that show the actual number of people who are truly, despite whatever the data would say, unwilling to be vaccinated is typically around 5%. There's a large percent of people, however, who need more questions answered, and it becomes incumbent upon us to put that data in front of them in a way that answers their questions.
Great. Well, we have run over. Thank you, everybody, for joining us. I know some folks need to get on to the DHHS media briefing as well. Thank you all for joining us. And what we were going to do, we'll have the file of the video. We're going to upload that to YouTube, and then we'll make it to our Duke colleagues as well. So you'll be able to get it from one or the other. So thanks again for joining us, and we will see you next time.